Sometimes it takes a minute. Hey everybody, welcome back to HawkTalk Live. I'm Kate Miller. I'm excited about this one. We will be starting in just a few minutes. I'm with Mark Kovacs right now. He's on the line. We'll be starting the presentation, like I said, in just a few minutes. We're going to wait for people to join in. In the meantime, don't forget, if you tag HawkTalk Live on social media forums such as Facebook, Instagram, I don't tweet, but Twitter as well, you'll be able to win a t-shirt, and we'll get your information through those outlets. So stay tuned for just the next few minutes, and the webinar will start. Next week, I'll be talking to Dr. Jay Greenstein about various things. He is an infamous chiropractor and has a lot to do with safer pain strategies and athletic performance as well. So thank you for joining us again, and we'll be with you in just a few minutes. I always wear my little flower. I think it makes me look like I'm kind of a 12-year-old, maybe a little bit young. But
you look relaxed, which is good.
I live on Aloha. I live Aloha time. If I could be in Hawaii right now, I would. Also, for all of you guys who are still continuing to join in, I will be posting information that we discuss, and maybe some that we may or may not get to. Hopefully we'll get to everything in the chat room. This would include information on the Kovacs Institute, on books that he's written and where you can get them, his articles, things like that. So if you have any questions during the webinar, please don't hesitate to ask. You can type them in the chat room itself, and I will get to them as time allows. Most of the time, we usually wait until the end for a Q&A session, but this webinar isn't restricted to any types of questions necessarily, but if you have something in regards to athletic performance, his institute personally, usage with the tools, please don't hesitate to ask. We appreciate any kind of interaction that you guys have to offer, and we'd like to help and answer those questions. So again, we're going to get started about now. My name is Kate Miller. I'm the resident clinician here at HawkReps. I'm also the education coordinator, amongst a couple other hats. I'm happy to do these, and I'm really stoked to see more and more people joining each week. For those of you who are repeats, I appreciate you guys coming back. Mark, I'm going to let you introduce yourself, and this is where you get to kind of be narcissistic, talk about how amazing you are.
Hey everyone, really excited to be on here with HawkTalk Live. My background, just so people know sort of where I've come from, what I've done. I grew up like a lot of folks in this field as an athlete. NCAA title, so played at a reasonably high level, and then had some shoulder-related problems. Had bicep tendon repaired, had a rotator cuff issue, had a subscap nerve defray, so a bunch of stuff going on with my shoulder, and that's what got me into this whole field of how do we train athletes better. Started off as a strength and conditioning coach. Spent time early in my career down at IMG Academy as a strength coach, working with a lot of sports, and then really got interested in the research world. Went back and did my PhD in physiology with a lot of work in biomechanics as well, and then sort of combined my passions of tennis with sports science, and worked with the US Tennis Association for nearly 6 years, heading up their sports science department, as well as being a big part of the strength and conditioning world and coaching education. So really wore a lot of hats, did a lot with the US Olympic Committee as well during that time as a national governing body. Then had an opportunity to work with Gatorade and be the director of the Gatorade Sports Science Institute. We did a lot of things in a lot of different areas related to sports science, nutrition, recovery, sleep, both in the research area and also working with our elite Gatorade athletes. And then over the last 4 or 5 years, I've been based in Atlanta. We set up our institute, the Kovacs Institute here, which was really focused on in-depth assessment of elite athletes, working with a number of sport technology companies, doing research and validation testing, as well as linking in with teams, leagues, companies, as well as associations to try to help better integrate sports science services, technologies to optimize performance and reduce injury. So that's a quick snapshot of my background. Really jumps around the areas of optimizing performance, reducing injury in a way that is evidence-based as much as possible.
I love it. I mean, I was looking around on your website, which I posted up for all of you guys to see before we get into the nitty gritty. And you guys really do. It's a one-stop shop for these athletes, which I think is pretty incredible and somewhat rare if you think about it. There's not a lot of places where you can get the strength and conditioning, the massage, the physical therapy, physician, both medical maintenance, recovery. I mean, basically, you can name something that an athlete needs and you have it. So kudos to that.
I think we do quite different to a lot of places. We don't train athletes year round. So our goal is not to be a training facility for athletes. It's actually an advisory service. So strength coaches, sports scientists, physical therapists, athletic trainers, sport coaches, they will actually send their athlete to us, or they will come with their athlete for sort of a second opinion, trying to make sure they're not missing anything in the treatment, care, training of their athletes. And that's an exciting part for me because we get to go into depth and we spend a day to a week with each athlete to try to make sure that we're checking all the boxes, we're finding as much stuff as we can that is actionable, and then working with their teams for their day-to-day training.
And that's awesome. I see that you do a lot with tennis. And would you say that's the majority of your athletic population, or do you work with, and I'm pulling things out of a hat here, water polo, or do you see a wide variety of athletes from water to land to other?
Yeah, so throughout my career, I've worked with a lot of sports, from football to baseball to basketball, soccer, golf, and where we've focused in, we do probably, I would say, 40% of our athletes are tennis athletes. Do a lot in golf, do quite a lot in soccer and baseball as well. Still have a few football athletes that come in. So we try to specialize as much as we can. I've done figure skating before and things like that. But in general, the goal is to try to be a higher level service. So we're not trying to be everything to everyone, but really trying to make sure that we're giving them the best service possible. Mainly rotational sports and overhead athletes. They're the two main areas of focus that we feel we have the most experience in, most knowledge in, and able to apply the best evidence to training and treatment protocols.
Great. And you see everything from injury, post-injury, pre-injury situations, or is it more of prevention situation?
Yeah, so we avoid the post-surgery time period. That's not an area we focus on. We have a lot of resources that we will recommend athletes go to, but we'll take athletes who are dealing with chronic injuries, athletes that are dealing with pain, but it's still allowing to train, try to work on space work as well.
Awesome. So I know, given that awesome introduction, what would you like to touch on first? I know we have a couple different subjects that we wanted to touch base upon. Where would you like to start?
Yeah, I mean, I think with a lot of the things that we're doing, we spend a lot of time in the sport technology world monitoring overload, recovery, sleep, and how do we make sure we're monitoring the right things? Because we've got a lot of different people involved in athlete careers, from the weekend warrior to the elite professional athlete, but the premise is the same. How do we do a better job of monitoring what's important, and what tools do we have available to us to do that? What are low-cost tools if you're on a budget? What are higher-cost tools that are valuable and good use of resources? And we spend a lot of time working with companies. We're working with companies out in Silicon Valley, in Israel, in Europe. We're doing variable resistance work, trying to do a better job of strength training so that we're not necessarily overloading athletes. We know the benefits of strength training. The challenge is there's a lot of risk with some forms of strength training if it's not applied correctly with the right athlete at the right time. So we're working with some stuff trying to do a better job of evaluating that and adjusting exercises, modalities, treatment plans, things like that. So I think what's interesting to a lot of folks is, where does the research take us? I teach a graduate class in technology and sport. It's one of the few classes in the world that actually focuses in on that. And each time we teach it twice a year, we review the latest literature, we evaluate the different areas. You have load monitoring, for example, which is GPS, which is internal stress versus external stress, heart rate, velocity metrics. We've got a lot of that work, and then we're also looking at what are internal load metrics that we can do a better job of, such as surface EMG and wearable clothing. Are there biometrics information that we can do a better job of understanding, that you can make decisions in real time to reduce the risk of injury potentially, but also to help player health and safety, which is a huge issue, especially with hot and humid conditions, preseason football, things like that. So there's a lot of these areas that cross over, but again, they focus in on what's best use case. Is there good evidence around the technology itself from a validation and reliability standpoint, and is it actually actionable? There's a lot of great information being gathered. The challenge for most people is, how do we adjust our training and our treatment protocols quick enough, well enough from that information to actually help the athlete? And that's one of the areas we work with a lot of teams and leagues on, is how can they integrate that information that they're collecting from all the great technologies that are out there in a way that is actionable and you can make an immediate impact on your team or on your individual athlete.
Great. So you use a lot of that stuff, one for kind of, for lack of a better way to put it, counseling these athletes and their respective clinicians, the treatment team. Do you take in, so say we have somebody listening today that wants to learn more about these methods and these models that you're using. Do you advise clinicians of sorts that maybe are not part of a major team, or how does that work?
Yeah, so individual clinicians, I think, in a challenging environment right now because the technology space is rapidly advancing. They're exposed to hundreds, if not thousands, of different possibilities that they could use to treat their athletes, whether it's for performance purposes or for injury prevention or prehab reasons. And the challenge is, everyone's got a finite budget. You've got a limited amount of resources. You can't buy everything. Not everything works either. And that's where we help a lot of these folks in giving some unbiased equipment. This has good validation behind it. These are reliable. And for your money, this is probably the best use of your resources. So that's what we do with our teams and some athletic departments and things like that. And we also can do that with individual clinicians as well.
Oh, awesome. Okay, so here's the money question of the hour. How do you incorporate, and we've already started receiving questions, how do you incorporate the tools into your treatment models? And I know that, and I can keep saying this every webinar till I'm blue in the face, that any treatment program is very patient specific. I mean, a patient specific model is what good clinicians should live by, not the assembly line like maybe it used to be. How do you incorporate the tools into your program, and how have you seen it make a difference in either the prehab or rehab models that you're putting out?
For sure. So a lot of the ways we use it, which is maybe a little different to a lot of the clinicians out there, is we're not necessarily we're not seeing an athlete for multiple days or multiple weeks in a row to fix an issue or to clear an issue. A lot of what we use the tools for is for mobility purposes. Let's use a squat example. If we have some mobility restrictions on the squat and we do our testing, we do our diagnostics using some of the things we have at the lab, and we find limitations, weaknesses, instabilities, we'll use the tools to advise the team on this needs to be done on a daily basis before the movement, to open up, to reduce restriction, to allow greater blood flow so that the athlete can perform a slightly greater range of motion. We may get 5 to 10 degrees greater range of motion in ankle dorsiflexion if we utilize the tools before a squat, which, as we know, that's going to make a significant difference up the chain, through the hips, through the thoracic region, through the lumbar region, even if we can do a better job of getting a bit more extra range in that area. So that's one example, and then we use it just like a lot of other people for adhesions, for restrictions, for mobility work, trying to make sure that we can help the athletes get through their various ranges of motion that we're looking for. And from a lot of our athletes, our overhead athletes, we have a lot of arm-related challenges sometimes, elbow issues, bicep tendon issues. We have brachioradialis tightness, tennis elbow, golfer's elbow, wrist range of motion deficiencies, so flexor extensor challenges. So we'll spend a lot of time, advising some of the folks involved to, really spend the time on those areas on a regular basis. I think the biggest challenge is many times people just go to the pain spots, and we try really hard to advise against just dealing with the pain. You're never going to fix your issues. Go to your cause, figure out where your cause is. Typically, we know it's lower down the chain than wherever the symptom is. Take care of that. Make sure that we utilize the tools as best we can, because they are portable. Many of our athletes are on the road a lot, traveling. So we also advise some of the athletes to do self-care as well with the tools, so they can take care of themselves when they're on the road and maybe away from their clinicians. And then the clinicians will give them sort of at-home programs to do with a tool. And then when they see the clinician can go into more depth, more advanced movement, more advanced techniques. Of course, it requires a second person to deliver it.
Yep. That's awesome stuff. We have another kind of question to piggyback that, if you don't mind. And I completely agree with it. Thank you, Jason, for asking this question. So I'm going to read it verbatim. There seems to be a lot of articles out there that bring the effectiveness, the efficacy of iStim into question for practitioners. We know firsthand how much this can help patients, and yet we're starting to get questions as to evidence, studies. So say you have a clinician that brings in either a team or team members, and you start talking about different treatment technologies and, for one, the tools. How do you address the validity is not the word, but the efficacy and the EBP, the evidence-based practice of iStim specifically?
It depends on what we're talking about. Not everything fixes all issues. So we have to be clear on what we're using it for. We use it a lot for restriction, range of motion restriction. We know that it can do a good job of increasing immediate range of motion. Does that mean it holds for a long period of time? Not unless we continue to do it on a daily basis with a flexibility and mobility program. But it gives you that starting point. It's a catalyst for the way we use it from that perspective. And that has been shown that we can increase range of motion immediately. The hold aspect, multiple days, how does it affect you in a week or two? That's like a lot of things. It needs to be continued. From an adhesion standpoint, it's one of those aspects where you get perceived benefits from the athletes, which is of value to me and what I do. Because I work with a lot of elite athletes, and we need them to feel better. And feeling better is the goal. Sometimes we understand that we may not be making physiological or structural change in one session or two sessions, but we're making an immediate perceived benefit for the athlete, which allows them to go out and train the next day, which by itself is very, very valuable, because there's 20, 30, 40 days a year where they may not be able to train unless they got this treatment. So you've just increased their training time, and that by itself is a value. So totally understand, not all studies are going to show, value for certain treatments. That's in all areas. The challenge is it more valuable than other potential modalities? And we find it very valuable for those specific examples that I used and many others. So it comes down to understanding what we mean by, what's the efficacy. There's efficacy for some things, and then there's not efficacy for other things. So you have to understand your tools and when and how and if you're going to utilize them in the appropriate ways.
I think that's an excellent answer to the question. And I mean, it really goes back to that patient-specific model is, how are you using it? Are you using it for a more neurological purpose? Are you using it for the proverbial breaking adhesions with these tools purpose? I mean, as long as the clinician is knowledgeable of the different methods of use for these tools, I mean, which you can learn in courses, of course. I wouldn't just buy tools and try to figure it out on your own, because there is there is a method to the madness. But as long as you have a reason and a purpose, just like for ultrasound, just like for Easton, just like for stretching, for any other type of treatment modality, as long as you have a purpose, that's what you would explain to whether it's a patient, whether it's a doctor. I've had a lot of MDs come up, well, why are you doing this? You know, when I used to work at the VA in San Diego, in some of their specialty clinics with my amputee patients and whatnot, I was like, why are you doing this? And if you explain that you want to increase circulation or et cetera, then people tend to bite onto that a little bit better. And if anybody out there, if you are looking for research, I know that we have a plethora here at HawkTalk. I know that you can find some through the American Physical Therapy Journal, et cetera. And I'm not sure if you have any studies available to you as well. So please feel free to reach out, and we can provide that research for you to have on hand. When I used to treat, I would have a research folder in my drawer in my desk, so that if a patient or a doctor asks, I'm like, here, I can explain it to you till I'm blue in the face, but here's some proof. You are going to find studies that go either way, but that's with everything, as he said.
And also, it's who's your population group and what are you trying to accomplish? Yep. You know, pain relief is one. You know, you've got blood flow, which is another. You've got range of motion, which is another. So you have to ask yourself, why are you doing the treatment? What's that area? Then you've checked your box of what you're trying to accomplish. If your goal is to increase range of motion, we know we can do that with, you know, this speeds up that increase in immediate range of motion. That's valuable. So all those things we know are valuable. The question is, if you're trying to use it to predict injury rates or predict something, that's a lot harder. There's so many variables. So you have to be a bit careful about what you're looking for and what you're hoping to accomplish from any treatment.
Right. Now, I appreciate that question, Jason. And Jess, we're going to get to your specific treatment questions in just a minute. You've written a couple books. You've written some articles, some very specific on tennis serve, a prevention program, right, for quarterbacks. Would you like to discuss any of those before we continue with the ice?
A lot of the work is related to the overhead athlete. We've done a lot of stuff. A few different resources out there that people may want to take a look at. I got a couple of them here. So this is Complete Conditioning for Tennis. This was written with Todd Ellenbecker, who many of the folks probably on this call know, and Paul wrote it. Two of my mentors and two folks that I've worked very closely with. And the goal of that is really to provide an easy to understand reference manual for folks. That's more aimed at the general population. If we've got folks on here that are clinicians, physical therapists, athletic trainers, strength coaches, chiropractors, MDs, we set up a trade association nearly 7 years ago now. It's called the International Tennis Performance Association, and it was targeting individuals that work with tennis athletes, that work on the performance side, the prevention side, the injury maintenance side, things like that. So go to the itpa-tennis.org website. There's levels of certification there. It goes into all the different things a clinician needs to work with tennis athletes. It talks about strength training specifically for tennis, testing, assessments. It goes into periodization and planning, scheduling, how to work with older adults, how to work with young athletes in the tennis world. It just allows you to have a better sense of communicating with coaches, with parents, with players, with people involved in the tennis community, and linking your already strong skill sets to that audience. So that's a great resource for a lot of folks that do potentially want to get into the tennis space. So that's a great resource. This one, is a simple book on dynamic stretching. This one was done quite a few years ago now, but it really went through the initial science at the time of dynamic stretching, what was out there, and then it provided easy to utilize sport-specific dynamic stretching protocols that can help with flexibility, help with range of motion, and just allow you to implement appropriate protocols. Because as we know, a lot of people do dynamic warm-ups, dynamic stretching. The challenge is understanding how and why to implement it for your athletes and what you're trying to achieve.
Excuse me. As we're talking about healthy athletes and whatnot, I want to be very clear that I'm not drinking a sugar soda. This is not soda. This is bubbly water. I've had a few people ask, Are you drinking soda? This is not soda. I don't drink soda. Just to be clear. So for you guys who are listening, I thank you for showing me the books so people can see what they look like. I copied and pasted in the chat room. It looks pretty hefty. I apologize, but it's links to both Amazon, his website, and his articles. So you can kind of, if you're interested in learning more about those books and some of these methods, please feel free to click on the links directly, or you can copy and paste and save it. The replay of this webinar doesn't give you necessarily all of that information. Again, it gives you our little our pretty voices, but not the list. So I would recommend writing those down or copying and pasting, or you can reach out to any of us directly and we can give you that information as well. So we have a tennis buff in here that asked about a specific technique for lateral epicondylitis using the tools and your technology methods, what you would use if a typical patient came in. What would be your A to Z process?
Sure. So it depends a little bit on the severity. So if they're coming in severe pain, we have to deal with some analgesic response initially, deal with that challenge, which tools become very valuable there, relieving some pressure, going all the way up into the shoulder as well and into the top of the bicep, which a lot of people sometimes don't do. They don't take care of the entire arm. A lot of tennis elbow related problems, unfortunately, in the tennis world is due to bad technique. It's rather interesting. No good tennis player at the highest levels of professional tennis has tennis elbow. So you get much more medial epicondylitis, golfer's elbow issues in good tennis players, but professional tennis players don't get tennis elbow. It's for the weekend warrior. It's for the person that has bad technique. So you have to address the cause. The cause usually is poor technique. So as a clinician, provide that feedback in a nice way, saying, hey, I can recommend you to an instructor who your office or your clinic. You have to deal with the issues at hand. So one is going through probably your traditional treatment modalities that you would utilize, your non-invasive ones to start with, more conservative treatments, from a standpoint of, blood flow movement is one of the biggest ones, especially initially, and then assess range of motion. Assess range of motion in the wrist and in the shoulder. If they're restricted in internal shoulder rotation, we probably have a cue that if we take care of some of that, it can help a little bit with some of the elbow-related challenges. If they're restricted in flexion and extension, and ulnar and radial deviation in any 4 of those movements, at the wrist, we know we've probably got some limitations that are causing the elbow to do more work than they can. So go through the full assessment of that body part and try to see, are there cues that you can work on from that perspective. And then a lot of what we do is blood flow, increasing blood flow, using your different techniques. As we know, there's a lot of different ways to get blood flow to the area, but we want to make sure we're getting good oxygenated blood in there as much as possible, help with the healing process. And then once you get past that point of immediate pain, then you have to go and implement your training exercises that I'm sure most of the folks are familiar with. We use a lot of the various movements where we'll be strengthening the entire region, using towel movements, using flex bar movements, using a bunch of supination, pronation, flexion, extension, strengthening, eccentric loaded movements to try to get the athletes to get as strong as possible in those areas. But we got to be really careful. We see a lot of people overdo that too quickly, and then the person has more pain, and then they get pissed off and you don't see them again. So you've got to ask yourself, if someone comes in for tennis elbow once or twice and then you never see him again, you may have overdone your recommendations because you've just increased the pain. And we see that quite a bit. We get a lot of people that call and say, I've gone to this person, I've gone to that person, and they made it worse. And when I hear that, I say they didn't make it worse necessarily. They were probably trying to do the right thing. They just were a bit aggressive in their exercise prescription too early in the process.
Right. And I think I was reading about tennis elbow actually not too long ago, and I really don't know why because I don't see much of it. But it's a statistic where there's it was 75%, something like that, of tennis elbow patients actually have postural or a shoulder issue, so bad form. In other words, they're internally rotated, they're hunched, their scapulas are winging. And so there's a muscular imbalance starting from here that's actually referring and presenting more at the elbow. So,
and then you can even take it down the chain even more and start looking at opposing hip and opposing ankle and that crossbody, pattern issue. And we see that a lot. And again, it all depends on how much time you're going to spend with your athlete, how much you actually can try to fix everything that could have potentially started it. But like you said, you have to at least go upper limb completely and scapular area, because if you're just treating the elbow portion, you're really missing out on the majority of where we need to spend our time.
Especially with these rotational athletes. I mean, you have to look at not only both sides, but the spiral line, I think it's called in Thomas Myers, to really maybe find the culprit versus the presenter where it's presenting.
Exactly.
Awesome. So can you maybe go into a little bit more before we start maybe asking about specific techniques that you use the tools for, maybe a little bit more of the technology. So this is a new thing for a lot of clinicians, and I don't consider myself, okay, maybe I consider myself kind of old at this point, but I'm still getting to know a lot of the different CRMs that are out there and documentation processes and assessment tools and things like that I mean, I graduated 5 years ago. It's not like it's been a long time for me, but there are still a lot more things available than there were 5 years ago. There are things that students are learning in schools about, whether it be DC, PT, et cetera, ATC, about assessment tools for range of motion or for athletic performance that I don't think I've even heard of at this point. So if you could enlighten us maybe on one or two that you use that could help familiarize maybe the younger and the older clinicians that might be listening.
Sure. So there's a lot of potential tools out there. We use some 3D motion capture devices, which may not be as practical for most people.
We might have lost you for
sorry.
No, you're back.
So we use quite a bit of inertial sensors that allows us to give movement accelerometers, range of motion finders that allow athletes to go through their normal movement patterns, and we can see where some range of motion deficiencies are, where some stability challenges may lie. Because one of my biggest challenges with most of the traditional assessment models that came about from orthopedic surgery in the old days to now physical therapy currently is most of them are done in an in-office type environment where it's slow movements, very low velocity, even relatively stable assessments, which are valuable for certain things, but they don't necessarily correlate or translate well at all to on-field athletic performance. So we have to be a bit careful on what we're using our assessments for. So we try pretty hard to use some of the traditional range of motion assessments, stability assessments, functional movement assessments, but then also adding high velocity movements with various motion capture options, just even 2D, high frame rate 2D caption. We use a company out of Israel called Physimax, which uses some newer technology that allows you to digitize the body without marker systems, which is really, really useful. We're also involved with some stuff with a couple inertial sensors that allow us to see positional data, which allows us to check if an athlete's cutting, changing direction, drop jumping, what's happening, and what are the forces and loads and torques at those positions. With it. But the challenge right now is, what are you going to do with that data? If you get enough information from a standard, overhead squat, that gives you 70% of what you need to make a treatment protocol for your average athlete, that's fine. If you're working with an elite athlete and you've got to get really, to improve performance and hit on all those markers, using some of these more advanced technologies will give you more specific detail. The challenge is more detail isn't better if you don't know what to do with it, or if it's just a bunch of numbers that you don't have the skills or the background to use those numbers to change a treatment protocol. So my biggest suggestion, we use a lot of old school kind of traditional techniques as well. So it's not that we just use a bunch of new technology. I like tried and true tested information, stuff that has been around for a long time that we know correlate with certain things. So it's a combination of applying the technologies that you may have access to then using what you also know works, because I want to use stuff that works. We're not hugely big in ever using anything with an athlete that we haven't tested. We don't have the research behind it, whether it's our internal research first or hopefully published research. We work with a lot of the companies to try to help them get some published research, some evidence-based information out there. And the goal is really to make sure that you get the information you need as a clinician to then implement your appropriate treatment protocols. And that's the two phases of this. The assessment side of it, you've got to remember that assessments don't usually predict injury, though. Predictors of injury. And, that was one of the big themes at the International Olympic Committee Sports Medicine Conference.
Yeah. I'm so sorry. Can you say that last sentence again? It kind of cut out. So what is it that's a better predictor of injury?
Yeah, so that's the challenge. The assessments in general, nearly all the assessments that are out on the market have limited predictive ability with injury. Some have some predictive ability, but we know that injury has so many variables. Fatigue is a large one, rather than muscular imbalance or something like that. We know that if the body isn't functioning correctly, it's going to be restricted in certain movements and overworked in others, which logically makes sense that we're going to have more problems, but it's not a strong correlation in most scenarios because the athletes, especially elite athletes, are really good at adapting. Part of the reason they're abnormal is they've adapted to the sport, and we've got to be a bit careful of trying to balance out everyone. Pure balance in most sports is not the goal. It's about optimizing their current movement patterns, optimizing what works for their and how do we best go about that?
I think that's a very important concept, because if we don't, and I'll say it again, it goes back to that patient-centered model. You have to take each individual as their own, but also just because 0 to 90 degrees might be optimal for some people in a certain joint, doesn't mean that's optimal for a different player. I mean, I think last week we were talking about, was it a contortionist, I believe, for the Cirque du Soleil? That their needed range of motion for certain activities is not normal per se by the book. So you have to really consider the athlete as an individual when you're treating them. So I think that's a very good clinical pearl to include there.
No, and I mean, I think a big one to go on with your point is, for a lunge, for example, most environments say don't let the knee go over your toes, as a general rule. That's probably the worst advice you can give an elite athlete. Nearly their entire athletic career, they're having to function in those positions. They need great dorsiflexion. They need to be able to get their knee over the toe. They're not doing it with 300 or 400 pounds on their back, though. That's where the knowledge is important. If we're going to lunge with a really heavy barbell on our back, we don't want that knee going over our toe, because that's increasing risk. But if we're doing body weight type movements, body weight plus 10% type movements, then we do need to push them in those positions because we need to prepare them for the sports activities that require them in those positions.
Right. And is it going to be an explosive movement? Is it going to be plyometric? Is it going to be something that's isometric, stationary for quite some time? I mean, it definitely is highly sport specific, I'd say. So
and I was also just going to say the research information from the normative data, when we say, hey, an ideal range of motion is X for this joint or this position, we know that's usually median data published in the research, which I've done quite a bit of research, and I understand that we need that. The problem is if you're working with high level athletes, they're usually outliers, and median data is useful for a researcher, but it's not always the best data to use for a clinician who's working with an exceptional athlete. So it's just important to understand how to read the research and use it appropriately.
Right, and then pay attention to that person's normal, not normal what's in our college textbooks or anything like that. So we have some questions in regards to the tools. Big surprise, I told you this might come. So what is the tool that you use the most?
It's a really
if you need.
it's a really, really good question. If you show me a couple of the ones you have there, I'll show you which ones we get most use out of.
So I can't live without my entire gold set. I'm picky. Because I work with so many different types of patients, whether it be pediatric, amputee, geriatric, I like to have the full set. But I guess if this is there we go. What would you say? So I know it's hard to ask in general what, if you could pick one tool sort of thing, it's really hard because it's probably very clientele specific. But
it is. That's the challenge. I mean, it's not a single tool use, it's more body part use. And I'll use 3 tools on the same body part. And that's the challenge. So I think you want, if you're looking at it from a perspective of, okay, I'm not going to get the whole set, I need 1 or 2, I would get the one that you feel is most versatile for your population group. So if that's the decision-making capacity, because as we know, a lot of the tools have multiple uses. You can use the top, you can use the bottom, the side, and get a similar movement or similar range that you're looking to go through based on the tool that you're using. So I never like sort of saying, okay, this is the number 1 tool, because they've all got different uses and different value. So I think it's important to understand, who are you mainly working with? Are you working with very large, say, individuals that need larger tools, and you could apply that to even their forearm, for example? It may be typically a tool designed more so for someone's leg, but you've just got really large athletes or really large people you're dealing with most of the time, get the larger tools. If you're working more so with someone or types of sports that you know it's a lot of shoulder and elbow, you're going to get something that is going to be a bit more specific for them. So I think that's the better suggestion, because like you said, I use all of them in different ways and implement them when needed. So it's like everything else. You've got a toolbox there. You've got to know when and how to use them, and then also how to adapt. Because if you are traveling, you may not travel with the full set, or you may, depending on how you set it up, you may only take one on somewhere. So you've got to learn how to adapt that to the different modalities that you're most comfortable with.
I warn people, careful taking them on the plane because they look like weapons. Yep. So I just a quick clinical pearl for I've taken them with me, but I keep my license on me as well. So it's easier to explain why I have a big, heavy metal object that, looks like a crowbar in some ways. So take your license. Otherwise, please package them and check them. It's the safest way to go about it. While we're talking tools, I just want to mention that you do use our tools. I'm going to put up your specific link. He has, Dr. Kovacs has been gracious enough to share a link where you can get a discount for these tools. I'm going to post it in the chat right now. So you can either go to this link directly and it'll take you to our store, or you can use his code Kovacs10. It's going to give you, and I posted it in the chat room again, it's going to give you 10% off anything and everything in our store, from t-shirts to emollient to tools to our courses. If you'd like to better train yourself on some of these methods that we've been talking about. So please feel free to go check that out. Again, if you have any questions, you can reach out to myself. I can answer them as best as possible for you. But those codes are active from now until hopefully forever, until you're with us. So thank you for sharing that with our attendees. And that's active now. So if you want to learn more about these tools that we're using, we also have descriptions online. And you can ask myself or Dr. Kovacs personally, as I've also put up his information. Do you have any other lessons, pearls, things that you'd like to add about your business, about things that you're doing before we start to wrap up?
Yeah, sure. I mean, there's so many things in this space that can help a lot of athletes, and my world's predominantly based on athletes. Also work with some elite executives from a high performance standpoint, so we treat them the same way we treat our athletes. We just adjust based on their goals. So, we do a lot of work from that perspective, and the tools come in very handy there because the pain, lower back issues, things like that. And, we spend quite a lot of time focusing in on those areas. So, although 80% of what we do is, elite athlete focused, we have elite professionals that are trying to function like elite athletes from a psychological standpoint, from a performance standpoint, from a competition standpoint, just in a different environment. So we've got a lot of stuff going on at the Institute. I think all my contact information is there for people that want to reach out. We have some educational courses in the tennis space if people are interested. One is based on movement training. So for the folks that do work with tennis and are interested in movement, go to our website. There's the Secrets of Tennis Movement are on there. And then we also have a very useful and very in-depth fitness combine for tennis that we developed a few years ago with a lot of normative data, very similar to the NFL combine, but designed for tennis with about 30 years of normative data. So we actually have very good predictive ability on certain tests with certain tennis movements and how to understand where your athletes fall. So those are some resources that may be of interest. But yeah, there's a lot of stuff going on. All the social contacts are there at Kovacs PhD on Facebook, Twitter, Instagram. I'm reasonably active, so if you've got questions that you want answered, I always like to discuss with colleagues about different topics because most of the world I live in is rotational athletes, overhead athletes, and then the technology and how do we integrate good sport technology that works in an effective way.
I highly recommend everybody checking out his website because I've been looking at it for quite some time now, trying to see everything that you do. You really do some cool things for these athletes, and I think it's important for clinicians to be as knowledgeable as possible and more well-rounded as possible. So thank you for sharing all of that information. I've made sure everybody has it. If you, for some reason, got lost in that chat, I know I put up a lot of information. Reach out to me anytime, kmiller@hawkrips.com, and I can forward that information to you. Or again, if you just go to his website, which was one of the first posts, his contact information is on there as well. So I really appreciate your time. You've given plenty, and you've given us a lot to think about. So thank you very much.
No, very excited to be on here, and thanks for all you do as well.
Yeah. Again, before I sign off, his discount code Kovacs, all caps 10, will give you 10% off anything in our store across the board. There is no expiration date on that. So thank you very much for listening, and hopefully we'll see you guys again next week.